Hello, good evening to everyone. As usual, welcome to Kopi With Vans. Every Wednesday, 10 p.m. That's our show. So again, we have different topics that's coming in. Let's see one of the banners here today. Yes, so the banners here. So today we are going to talk about child with special needs, and we have two doctors on board. Dr. Shan, we call is a. I think you all got to meet him. He's such a gorgeous man. Even though he was a very tight schedule today, but he actually made it for the show. He's actually joining us very shortly, as well as we have also another doctor on board, Dr. Arvinda. So he will be joining us in a matter of maybe 15 to 20 minutes time. So just a little bit more about Dr. Shan as a consultant and a pediatrician. He's going to explain to us a little bit more and share with us of his journey, as well as what interests him to be a pediatrician, and also the cases that he has seen in a big spectrum of special needs over the years of practicing as a doctor. But just to go a little detailed in the special needs that we want to talk about today is that special needs are actually my parent actually going through a big, I gotta say, it's a big, not a struggle, but it's a blessing for them because it requires a kind of energy, a different kind of mindset they will be going through. But most of the time, parents with special needs often go under stress, sleepless night, constant worries of their kid, and so forth. But there are bigger ways that we can actually look at in terms of autism that we're going to talk a little bit today. ASD, autism is a neurodevelopmental disorder where a child has difficulties in social interaction, reciprocal communications as well, and marketed restricted into activities and interests. This may be also present in varying severity, right, that we will be looking at. But not only that, we also have some cases where actually parents go under a tremendous, earlier on I mentioned that parents go under a stress mode because of their children needs. They also have constant worry what may be for their future after they pass on, or at old age how they're going to be able to handle it. But all these cases in terms of special needs for children, they are just as normal as all other kids. But sometimes their behavior, because they can't control, and that actually is what makes them stand out as the special kids. But we shouldn't be looking at them differently. We're going to talk a lot of discussion today. We're going to talk about a lot of methods, or rather situation that the parent actually went through on different areas. So I'm going to bring up Dr. Shan up to have a little bit more understanding on what is this bigger spectrum that we are talking about. And let's me invite Dr. Shan Narayanan, please. Hello, Dr. Shan.
Hello, Vance. Hi.
How are you, sir?
Good evening, everybody.
Good evening.
Nice to meet all of you here. Yeah.
Dr. Shan, I know what exactly has happened in the past 1 hour, but even that kind of situation you still made it to be with me in Kopi with Vans. So I hope I've not rushed you, and the situation is stable.
Not at all, Vance. This is something I enjoy doing it as well, and I'm very appreciative that you reached out to me to appear in the show today.
Thank you, Dr. Shan. In the next 20 minutes, we're going to talk a little bit more on the issues, the kind of cases that you have handled, and also parents, what they should know about a child with special needs. I mean, parents, anybody can be a parent, but going through a situation where handling a special need requires a special kind of mentality, and also physical, exhaustions also can happen. So, but before we even dive into the questions and have a great discussion, maybe perhaps you want to do a short introduction about yourself, doctor?
Yeah. Hello, everyone. I'm Shan Narayanan, and I've got a nickname, and they call me the Kiddie Doctor. And I'm a pediatrician based in Ipoh, Malaysia, north of Malaysia, Ipoh. My hometown is Ipoh. I was born, brought up here, educated as well, and I did my basic MBBS in University of Malaya. Then went off to UK to specialize in pediatrics. And in the years of specializing in working in pediatrics, I've taken an interest with children with special needs. all children with special needs, and I have a specific interest in children with autism spectrum disorder. Right. That's a little background about myself.
Okay, doctor.
My practice
So,
now is in Hospital Fatima Ipoh. Yeah.
okay, doctor. So, before we jump into the questions that's lined up for you and we're gonna have a great discussion. So, just about yourself. To be a pediatrician, do you must have the kind of child character in you because you're always with kids around, right? So, whenever there's a kid, I remember when my kids were young, whenever they go and see a pediatrician, the next following day they are well. So, is there some kind of communication between a kid and a pediatrician, the kind of languages? Because you tend to be very very jovious, very your character is you're not those strict doctors. I don't know. I just felt that when
Well,
you sent me a picture of yourself, I didn't doubt it at all. But I was like, oh, doctor with some dolls and kind of stuff. So I understand that a child in you. Is there some kind of a connection between you and a child? Why when child see pediatrician they immediately stop crying and so forth?
oh, okay. Thanks for that question. Firstly, to do pediatrics, when you're deciding which branch you want to go to, and if you want and you choose children's medicine, that's pediatrics. You must first have a liking for children. That's the most important thing, and you need a lot of patience. So some doctors, I mean, we are human as well, get into a children's ward, they hear the crying, and they cannot stand it. But there are others of us who look at the crying as a form of communication. The child is trying to tell you something, or the child is unhappy. So the first thing is, I like children. I like playing with children. Like when my boys were young, we enjoyed that story time at night. In the bed, both of them are on either side of me, and we are just tickling and joking and this. So I enjoy children and enjoy that. That's number two. And I'm my general nature is I'm patient. And then in the years when you work with children, yeah, you have to relate to them at their lingo, at their level. The way you treat a baby, "Kuchichi, how are you?" and how you deal with a teenager is quite different. "Hi guy, how things?" That's so you adjust yourself according to their age, right? So the key thing that I want to message is you must have a liking for children to go into pediatrics. Yeah.
And also you are always surrounded with sweets and lollipops, so perhaps the kids or the children who comes to you think, hey, I'm going to get they're always happy to see you. Is that one of the reasons why you're always with sweets and kind of stuff around you?
Yes, we used to be. To be actually true, we used to be with sweets and lollipops. However, sweets and lollipops, yeah, makes them friendly with you. How, but it can cause dental caries, and a lot of sugar cause activeness, and children become extremely energized and active. So nowadays we change it to stickers, right? We change it to stickers. Some doctors give vitamins, one tablet for you, or the other is some fruits. We change it, but there are still places where you get lollies and this once in a while lollies and sweets are good as well. Yeah, and I think most of the time is because how you link with the children. Yeah, these extras help you to link, but eventually whether you can communicate with the child. Are you going to talk to the parent or are you going to talk to the child? And when you can link to the child likes you and they will uh, like to come and see you. However, one thing earlier you said the children see the pediatrician and stop crying. That one I agree and disagree. There is a pattern to this. First 6 months, the children, babies are not aware yet. So you are totally in control. So you are talking to the baby, playing with the baby. From 6 months to 1.5 to 2 years, they become aware. And especially after the first year vaccination, when they see your clinic door, they start screaming. They know this man is a jab man. He's going to jab me. But somehow after 2 years, it all settles. That's when the friendship builds. That's when the relationship or the friendship with the child begins to grow. Yeah.
So probably I think the kids understand your face recognition. They understand you, and they say, okay, he's going to inject me. So probably they know that. But whatever it is, doctor, I think as a pediatrician, it's very important because without pediatrician, I think parents will go through another a set of tremendous stress, when their kids are sick. And it's not just like putting panadols or put some ointment to to get away certain pains and symptoms. But I think as a pediatrician, you are more into it. You can actually see what exactly is happening to the child just by the movement, the crying, and also the posture. So great, great passion, doctor. I mean, you are in this line. Doctor, we're going to jump into the topic right away, so that we can kick things up. Doctor, today's topic is all about special needs. So, one of the main concern, I think, before we even go into psychology a little for the parents' mental state and how they face, but we want to talk about the situation first. We talk about the problems, then we go into solutions and possibility of what it may be in the future. We will talk about that. But, doctor, I mean, as a kid, I mean, when a parent bring a kid to you, is there any sign and indications that you know that probably this kid is already as a condition called autism? Do you have any indication, is or how is it being done to identify or to diagnose it?
Okay. To diagnose autism, there are a set of symptoms. But I think let me go back to the basics. The child development, there are four main areas. That is, one is the gross motor development. That is a baby who is lying down, learns to roll over, sit up, stand and walk and run, jump. That's gross motor development. The second is the fine motor development, where they learn to use the use of the hand. The pincer grasp is the most important, to pick up things, to comb the hair. Not that I comb my hair frequently, but it's necessary to comb the hair, do your buttons, write, you have to hold the pencil. That and the eye has to coordinate with the work what you do in the fine motor development. Then you have speech and language development. There's a pattern to the speech. Children understand first in the first year and start talking in the second year. For this, hearing is very important. So any child with speech delay, first thing we will say is have the hearing check. Then the fourth aspect of the development is the social, emotional behavior. And all these areas together helps in the development of the cognition, the intelligence. So there can be, when we talk about special needs, what it actually means is the child has extra needs. That's what it means. So a developmental issue can be in any one of these areas. If let's say the child, see, okay, going back again, we all these vaccination visits, every time they come for vaccination, we use it also to monitor the development. Some of this vaccination is done by the Ministry of Health, some is done by the private, and they use it for surveillance. They call it developmental surveillance. Every visit they ask you, can your child do this? Because there is developmental milestones. At 3 months, the baby's neck becomes, can hold the neck up, neck becomes firm. At 4 to 5 months, they roll over. 6 to 8 months, they sit up. 1 year, they to 1.5 year, they start walking. So we monitor this. Similarly, we monitor the speech and language. We monitor the fine motor skill and the behavior. So in this process of following up, then we look for red flags. Oh, they have not reached the milestone. That may be a telltale sign. If the gross motor development is delayed, then we are concerned whether this child has got some physical disability. Right. When we come to autism, then specifically we are looking at the speech and language and the social and emotional behavior. At one, at let's say by after 6 months to 8 months, the baby starts babbling. That's the first thing. They start babbling. They start babbling, and then at 10 months they learn to say bye bye. They start playing peekaboo with you. We are seeing if this development is happening. And if I go a bit earlier, at 6 weeks, they begin to have eye contact with the mother when she starts feeding. All these are important in our surveillance that we look at. And then the speech development. That is monitoring the child. But we also have situations where the parents walk in at 2 years and say, my child is not speaking. Okay. Not speaking yet. Like today, I got a referral, 2 years old, not speaking. Not speaking does not mean autism because speech delay is just one feature of autism. When the child doesn't speak, then we want to make sure the hearing is fine, and then we want to see whether they are, the parents and the family are communicating with the child, or the child is left alone to play. So we look at it as a whole picture. So from that speech delay, then I look at other areas of development. Okay, is this child got eye contact with you? Does the child point, right? And what is the child likes to play? What is his behavior like? What is his tantrum like? Because for autism, there's no blood test or scan to make a diagnosis. It is all from the history the parent gives and our observation of the child, and we can do some special test, which is playing with the child with specific toys. So this is how we come to a direction to make a diagnosis of autism. Is
Okay,
there
doctor.
anything?
Uh,
Yeah.
I mean, thanks for that explanation part. But when all these symptoms and signs you have noticed it, and probably that is an indication that is what the diagnosis is going to, because there is no a test kit. You do a blood test and say, "Hey, my status are such," and the possibility, the autism is there. But in this particular condition, there isn't any. Measurements by blood tests or some tests, but only by sign and symptoms. But when you find the sign and symptoms, and when you mention these to a particularly a newly-wedded couple, I mean, who just got married and they got a first kid, what is the kind of situation they go through when they hear this thing that my child is having autism? When you tell them, how do they break down, or they going through confusion? They say, "No, what, I'm going to get a second opinion." What is the reaction? Because you're in the front line. So when you break a news to them, or how is the situation back?
Okay. To answer that question, I tell you briefly the process in which I diagnose, right? The whole diagnosis process actually is ideal process is by a team. But what I do, I'll tell you what I do. What I do is I take at least 2 hours. The whole assessment is about 2 hours. But before the assessment, I give the parents a pre-assessment questionnaire because the child's real world is the home and school. Maybe they are going to a nursery. So I want to know how this child is at home and how this child is in the nursery or with the babysitter. So there's a form for them. And I also ask parents to bring video clips of how the child plays by themselves, how the child plays with other children or the sibling and their tantrums. Because I may not see everything in that 2 hours. And then I spend 1 hour with the parents to take a very detailed history from birth up to the point they come to see me. Following that, then I observe and I play one to one with the child. With some children, I use a special set of toys called Autism Diagnostic Observation Schedule toys. I use that with them. Following this, I put all that together and I make a diagnosis. It's only then I tell the parents, okay, with all this information, your child now is in, I can firmly say your child has symptoms and signs of autism spectrum disorder. And the parents' response, I've had various response. Their parents who have broken down and cried. Okay? I really understand them because when we have children, let's think of our own children. We all have a dream, and suddenly when someone comes and says your child's learning style is different, that's a dash dream, and that's a real pain, no, sudden pain. So they are parents. The parents who have told me, doctor, with due respect, you've only spent 2 hours. How can you tell my child is autism? I've spent 24 hours a day with my child and I don't think. So I said, I will tell them, I accept the answer and I say, yeah, you are entitled to a second opinion. You can go for a second opinion. And there are parents who have also outwardly told me, no, I don't accept the diagnosis. In all this situation over the years, I accept what the parents say, though I stand by my professional opinion. I don't impose my professional opinion on them, though I say this is my professional opinion. So the parents who break down and cry, I give them time to just pour out whatever they want to say. I give a pair of listening ears to them. I listen to what they have to say. Who parents who say no, I don't accept, or I say want a second opinion, I allow them to go ahead. And many of these parents, due respect to the parents, after 1 year putting the child in a kindergarten and the child doesn't adjust, they come back to me. They say, Doctor, the child is not accepting. So I think I agree with you that he's got autism. At that point, I don't tell, hey, 1 year ago, I told you, I don't go in that direction. I again provide that listening ears and listen to them. And I think this is called empathy, trying to understand them. And I think that's the most important quality needed when you deal with parents with children with special needs through the emotions though I have not gone through that emotions. I try to understand, and the best way to understand is providing this. That's why God gave us 2 years, to listen, and then to listen to them, and then to support them, and then to direct them. Okay, this is what your child needs, the therapy the child needs. This is the maybe you can try this special needs kindergarten for a year. This because I have seen success stories. I've seen a 2.5-year-old boy who has not spoken almost brought my clinic down, uh, because you're so active, no eye contact. And this was about 14 years ago when in Ipoh we had very minimal support, one or two centers only. But I told the mother, you go to the center, they give you once a week, you learn and you do the necessary visual aids to teach your child, because children with autism are visual learners, auditory and visual learners. Uh, they will talk. And this boy at 5.5, every night, 2.5 to 5.5, is attending the center once a week. The mom did the visual aids, sing songs to him. And 5.5, like a fairy tale story, he just turned and said, Mommy, I love you. And then he started talking. And today he is 17 and he is in a private college doing accounting, and he speaks English, Malay, Mandarin, Cantonese. Is a Chinese boy. He speaks that language. I brought him and made him speak to our doctors at a meeting to show them a diagnosis of autism is not end of the world. There is hope if you work with it with hope. And then today, in today's day and age, 15 years now, we have got more support. We've got more therapy centers. We've got more special centers. And I don't doom them to a special center. I say this is a transit zone. You go there, we alternate the behavior, uh, we encourage the interaction, social interaction. Then, when they're better, we send them to the mainstream. We send them to kindergartens where they can, regular kindergartens, and then try to send them to mainstream school. Because
No,
the very
doctor,
first question, yes, go on, yeah.
please cannot.
Yeah, the very first question, every person, the two things in my years of experience with the parents, the first question is, will my child go to normal school? Okay, that's regular school. I rather use the word regular, normal. God can tell this is normal and that's abnormal. What we can say is children who have regular learning style and a different learning style. That's how I look at them. Children with autism, they've got a different learning style. They've got many skills. Some of them are artists, musicians. This. So the first question parents will ask is, can my child go to a regular school? The second thing is, Doctor, what when I am not around?
Yes.
That's the second. The parents who have developed a close over the years, they can communicate with me. This question will come, Doctor, what when I am not around? So when they ask me this question in the early stage at 2.5 or 3.5, I give them this hopeful answer. I said, what is important is you have to focus now. Your child now needs the therapy Maybe can adjust in a regular kindergarten with support, but with the therapy, or may need to go to a special center for behavior modification, then come into a normal stream. So if you focus on now, right, your answers will come in time. This is what I told Xiu Feng's mother, the 2.5-year-old boy. She asked me, will my child speak? I said, Mom, let's focus now. You give him the support. And she got the answer. At 5.5, he started speaking, and today he speaks four languages. I mean, three languages and two dialects he speaks. So that's that. Yeah.
That's a very positive way of handling and looking at the situation, doctor. Because I mean, we all know as a parent, raising up kids, we have our own challenges,
Yes.
especially when with kids with special needs. I mean, it's a blessing. Probably, I would like to say that they are specially chosen to able to handle that kind of situation. That's why they are given that situation where they are go through. But even though, like psychologically, I think they are very worried. It can lead to parents' anxiety, depressions, insomnia, and constant worries, because they always want to give best for their children. But in this kind of situation, when the parent understands that, then they start planning it for the future. What happens when they are not around? Who's going to take care of the child? So it's a big battle that is going on the parents' mind, which I can really feel it, because there are certain situations that we will later talk on the discussion. But I'm going to pull up Dr. Arvinda here to a little bit to understand when a parent is given a diagnosis, right? Not for them, but for the child, how the parents actually really cope up with that insomnia, depression, anxiety, because the chances are there, because we never know what's happening at the backstage. Probably the mom is really concerned. Maybe it can be financial, maybe it can be the factor of the society, always giving judgment. Oh, look, you didn't raise up the kid properly. It's easier for them to give the judgments for the society, but the parent have a different kind of battle that they never share it with the society. So let's get it some in depth from answers from Dr. Arvinda. Hello, Dr. Arvinda.
Hi, Vance. Hi, Dr. San. How
Hi,
are you guys?
Arvinda.
Hi.
Welcome to Kopi With Vans once again, Doctor. The question
Thank
was
you.
just having a discussion with Dr. Shan, our consultant pediatrician. We had a wonderful discussion over the past 20 minutes, but we are now going into autism, and we're also talking about the mental state of the parent. I mean,
Right.
Dr. Shan has already talked about the possibility, the hope, when parents go under a situation, Dr. Shan said, no, look at the situation right now. Your child needs the best situation and care and concern now. Then stop worrying. It will come, but we will discuss about that later. But what will the parents' mental state will be if now someone says so and so your child has been diagnosed as autistic? What is the condition will go through?
So, Vance, I will speak on behalf of because I do a lot of primary care work, and at the same time, I'm also doing my PhD. I'm a medical doctor, but I'm doing my PhD in mental health. So, I will give you those two perspectives. So, whenever we see a patient who comes in with a child with special needs, a lot of times, many people they only see the child with special needs, but many of them they forget. And Shan can correct me if I'm wrong. That a lot of people forget about the parents. How are they coping with it? How are they dealing with it? The anxiety they face because Ben, you as I was hearing backstage, you have kids yourself. Sometimes the kids don't behave when they go to a restaurant or they go to a party, and then you come back, oh my gosh, you know what, I should have just taken my kids and gone. But can you imagine there are many parents out there who deal with this day in, day out because they have a child with special needs. There is nothing wrong with that. It is the challenge of facing it day in, day out. And I think a lot of times we keep forgetting that how much of anxiety, stress, and perhaps even emotional breakdowns which these parents may undergo through. I remember when I did my master's, there was another colleague of mine who did actually the emotional and mental stress of caregivers. I mean, any caregivers. You can talk about patients with oncology, we were giving caregivers, children with special needs, adults with special needs. There are many different people who need caregiving. And the caregivers actually undergo a lot of stress, especially depression, not only because they have to look after their child or they have to spend hours looking after the person who needs caregiving, but they have withdrawn themselves from society because they have now a dedicated job. It's a 24/7 job. A lot of them leave their careers. A lot of them leave their other extracurricular activities just to focus on caregiving. Now, if it's a short period of time, it's okay. But especially like how Dr. Shan has put it, if it's a child and the child is 2 or 3, you may end up, taking care of the child for a very, very long time. And it depends on how the child responds as well. So the parents can actually undergo a lot of stress and anxiety, and sometimes they can undergo depression. So I think there are two spectrums to this. One is to look at the child's aspect, and the other one is to look at the caregiver's aspect. The caregiver may not be the parents per se, it may be the grandparents because the parents are busy working. So the grandparents are looking after. The emotional attachment between that will be very, very different. So I think we look at different aspects. More importantly, is the mental health status of these caregivers. I'm not saying that the child does not have maybe they may not be mentally affected, but I think also the special attention should be given to caregivers as well.
Thank you, Dr. Arvinda. I mean, on speaking of the parents, on behalf of the parents, but if any parents who are watching this, if you do want to share your views and thoughts, you can either send me a private message or you can send it us in a message box, and we have doctors on board. We can talk about this topic, and we can also get a little bit more in depth as the discussion is going to go through. But if the news has been broken down, doctor, so the both doctors are here, Dr. Shan and Dr. Arvinda, I think parents will go through a tremendous a situation which they never forecast, or they never even expected that. But I think as a parent, when someone tells you that, hey, your kid has a special condition, at first nobody can take it as very positively. I mean, even how strong the particular person is. I think the first thing that attacks them is the worry, the financial, and also for the matter is they will probably can go into a situation of denial, can go into a situation of self-imposed, which is like, oh, what did I did, So a lot of guilty feelings, a lot of emotion that comes in. But I think at this point of time, I also like to say that as a society, when we go into a restaurant, Dr. Aveda, you mentioned it nicely. When there's two kids, right? One kid is with autism, another kid is without autism, but the same parents. But of course, with the inability to control of himself or her, that kid behaves out of autism condition. But as a society who sees that, some might just whisper, some say, hey, can you please control your kid? But they do not know what's the condition that a parent is going through with the child. So I think as a society, we shouldn't be fast enough to pass any judgment if we do not know the story. Because I've seen that, I've witnessed that before. But I can clearly understand that particular kid is a challenging kid, which has some condition because he's doing the same repetitive movement, like what Dr. Shan has mentioned earlier. He's not responding and he's becoming violent. And the parents are very soft, very calm. So probably the situation shows that the parents are adjusting to it, right? But as a society, I think more concern and love we should be addressing to it rather than passing hard comments or remarks that will be very hurtful for the parents. Even though they should be getting used to it, but I think every parent should deserve the utmost respect in all areas. Having said that, we are going to go into the questions, Doctor. So on this question that is actually for Dr. Shan. Dr. Shan, in your years of experience, how would you advise parents with a child with comorbidity, example, autism, ADHD, and mood, or even dyslexia, for the matter of fact?
Okay. Question. No? Advise parents. Okay. Let's say it depends. The advice given will depend on the diagnosis and the age of the child. Okay. Yeah, the age of the child. For children with autism, I mean, firstly, we need the diagnosis, and following that, the advice will be we have to categorize them if they are which level they are. The level they are is that now DSM 5 categorize them. DSM 5 is Diagnostic Statistic Manual of the American Psychiatric Association, which is the standard that we use for diagnosing autism. So they categorize into there are level 1, level 2, and level 3. And level 1, they need minimal support, right? Many a time, the issue of these children is the temper and social interaction. So they may be able to manage in the mainstream. So they can go to mainstream kindergarten. Whenever I see them at 4 years old, I tell them, try them in the mainstream kindergarten. You may need what is called a shadow teacher, another teacher to be with him. If his concentration flouts, then he just bring him back to the focus. That's level 1. For level 2, they need more support and they may have much more language impairment here. So these children may need to go to a specialist center, a specialist nursery or kindergarten for a period of time. And after the training, because in these centers, they do what is called individual education plan. They assess the child and then they determine the child's learning style and then create a curriculum, not a curriculum, a lesson plan for the child accordingly. And then work on the behavior through occupational therapy. And if they need speech therapy, then we try to integrate them into normal kindergarten. And for those in level 3, some of them can go through this transit, but if they also have difficulty in personal care and developmental delay, that means they're not walking. Let's say a 4-year-old child has got no word at all, and he had late walking, and he's got delay in all the areas of development, then this child may need a more specialized environment. So, where they will place this child is depending on the functioning of the child, not just the diagnosis of autism. What we are seeing is more children between level 1 and level 2 for some reason. We are not seeing many severe children. At least I'm not seeing many in my practice. And when I talk to my colleagues as well, we are seeing more on level 1, level 2. And children with ADHD, hyperactive, many of them, see, like when I learned that, the professor told me very few children have pure ADHD, pure autism, pure dyslexia. They have got a little bit of all, and you have to find out which is the predominant factor. Yes. So you make a diagnosis of autism on the predominant factor, but this child may also have activeness, may also have some learning difficulty. Here, when I make a diagnosis, usually that is again through the process. You make a diagnosis. These children, they have delayed speech, but they can speak. By the time they come to you, they are already speaking. They have difficulty very specifically when it comes to reading, writing, and spelling. So then you have to send them to a center where they can teach them. They need to go through the phonics, the alphabets, and the sound of each letter. They need to understand that. There's not a hearing problem, it's the interpretation of the sound by the brain is different. So that is why they cannot blend the different sounds together to make the word, to formate the word. So that depends there. But now, if you get a 14-year-old with dyslexia, what you're going to do? 14-year-old, when they come to you, usually they have already learned how to cope. Like I'm seeing a boy now, they've learned how to cope with their spelling difficulties. But what happens is these children, though they have specific difficulty towards reading, writing, and spelling, they are intelligent, they speak very well, so they know they are trying very hard, they cannot. So at 14, it's already affecting their self esteem and self confidence. And you see the child with anger. This boy, 14-year-old boy, came to me because of anger. The mother couldn't deal with the anger. And when I tried to work out the reason for the anger, we found out he's got dyslexia and he insisted to go into a school with a English medium school, but the parents wanted to put him in a vernacular school, and he was in a vernacular school, and you know the number of homework they give in a vernacular school is tremendous, and he was from standard 1 to standard 6 under pressure. He cannot perform, so at 13 years old he burst out in anger. So there we deal with the anger management. And then we try to adjust the learning environment to teach him to cope with his specific learning difficulty. So the advice that we would give for the child depends at the point the child comes to you. At that point, if they come at 2 years old, they come at 4 years old, or they come at 14 years old. So the advice will vary accordingly to that situation.
Thank you, Doctor. Thank you, Doctor, so much for addressing that particular question. Dr. Aminda, I got another question for you, which is, of course, it's related to the topic that we are talking today. It's about autism, right? Is genetic or hereditary? But of course, when I did a little bit of research, it shows that in 1977, that's the first research was done to do a study on a twins. But do you think the medical science in the future they might be able to do something, for these kids who are going through without their ability to control, and parents? I mean, it's both ways. It's never been about parents. It's about a child. Do you think in the future there might be something to able to cure to it, or at least to prevent it? Because probably we might not have the statistics right now to talk about it, but as a what just coming out, I think the cases might be high or might be low or maybe just maintaining it. But do you think in the future there might be a possibility to reduce or to even to prevent it? Dr. Arvinda, we are not hearing you. I think you need to unmute.
I can't hear you, Arvinda.
Yeah, sorry. I think whether it is genetic or hereditary, I think I will leave that to Dr. Shan to answer. But I think just really quickly, maybe Dr. Shan, you can answer, then I will go into the mechanics of it.
Okay, Dr. Shan.
The question is autism genetic or hereditary?
Yes.
Hereditary and genetic. If a condition is hereditary, then it is genetically linked. Okay. So the autism, we believe it is genetic, right? But genetic, what makes the difference? Hereditary means it is running from generation to generation. It's also genetic. But autism can be genetic as a new mutation in the new mutation. So right now, the belief, because we find autism in different, like cousins, they are having twins, they are having autism, it is a genetic, but it involves more than one particular gene. So they have not identified one particular gene to say this gene is associated with autism. But because it is found in families, right? And in families, they're like, you see, like currently I have a child, his cousin has got autism as well. Their two brothers and their children have got autism. This makes the likelihood of genetics as a cause of autism very likely. Yeah.
Thank you, Doctor. Thank you for that. Dr. Avinda, you want to touch base on that a while?
Yeah, so to add what Dr. Shan said, I think from a medical clinical research point of view, I always believe this, that at the end of the day, diagnosis will become more like now, like how Dr. Shan said, he needs 2 hours with the patient to diagnose. Sooner or later, as medical science progresses, and this is how medical science works, we will actually come and get into a classification. That means maybe they have enough of big data, they can say, okay, 1, 2, 3, 4, 5, 6. I mean, I'm just talking hypothetically. It may not be an exact thing, but hypothetically, symptoms 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, they make it a criteria. Like those days, if you want to diagnose diabetes, you will take a long time. They'll have to do this test, they'll have to do that test. Nowadays, within 15 minutes, you can actually know whether the guy is having diabetes or not because of medical advancement. I think it will come to a point where you actually have big data, enough data to support this. And of course, they will need people like Dr. Shan to actually validate this type of data. You will find that as we progress along, you will be actually diagnosing more and more people with autism. And I'm not only talking about kids, I'm also talking about adults, which were probably missed when they were younger. Now, whether it is 100% true or not may be entirely dependent. So that is why we still need a lot of doctors, especially doctors like Dr. Shan, who can sit and actually diagnose it based on that criteria. But I think as medical science goes about, I foresee 2 things. Number one is we diagnose early. And I'm sure Dr. Shan will agree with me that when you diagnose early, you catch it early, you catch the child early, or even the adult early. I mean, adult normally sometimes I don't think it happens really in adulthood, but in childhood when you pick it up early, I think you're looking at a better outcome because you're intervening faster. So I think I foresee that early detection and better interventions will come about with medical science as we go about. Again, I agree. It may depend on whether we look at it as genetic or not genetic, and whether there's enough scientific evidence to prove that. But as we go along, I foresee that medical science is going to advance so much that we are actually going to make things better, diagnosis and also treatment wise. So I foresee that happening in the future. When I don't know, of course, we need a lots and lots of data to actually back that up.
Thank you,
See,
Dr. Anita. Dr.
Yeah,
Chan?
when I think the thing was leading, is it actual increase or is an apparent increase? Is that what you're also leading to? Okay. To that, I think we are diagnosing more children with autism now because of
yes,
the increased awareness, not only in the medical fraternity, among our educators and also the parents. Nowadays, everything Dr. Google is there. They will check up and they will have an idea on that. So one increase is because of the awareness, because of awareness. Number two, many years ago, we didn't have proper classification or diagnostic systems. So now we have the classification system, the criteria. So and more clinicians are aware of this and trained to do this. So they diagnose more children. And our time, probably my time, I'm talking about in school, they just say this guy is lazy, stupid, is this, just classify and leave. And some of us just learn to adjust and cope with it, and we come out of it. See, so the one increase is because of the increasing awareness and also more classification system now, and we are using that. And I think there's a belief there is an actual increase in the number. See, it's very worrying, some weeks, almost every day, I'm getting one or two referrals of children with speech delay and difficult behavior, and this is
wow.
on the increase. That's very worrying. And the trend now, a lot of, with due respect to the caregivers and parents, because we are busy and we are working for the children, they leave the children with gadgets. And this one, when you are with the gadget at 1.5 and 2 years, and you're very clever to manipulate, the gadget doesn't communicate with you.
Correct.
The box doesn't talk to you. The child is looking at the box doesn't talk back to the child, so the child may not pick up the communication skill. Right? So that is now, we are now beginning to believe whether this is one of the which enhances this difficulty in these children. And I understand the current advice is under 2 years, no
No,
to any gadgets. Under
perfect.
2 years, no to any gadgets. So
I
there
agree
is,
with. Sorry,
yes, go
Dr.
on.
Shan. Go ahead.
Yes,
No, no,
Arvind.
please, please. No, go ahead,
No,
sir.
just to summarize, there is an actual increase, and there is an increase because of our awareness.
I
Dr.
completely I completely agree with Dr. Shan. The awareness has gone up. I think from what you read in the medical books in the 80s in the journals, and then when you look at over the time period, in fact, autism was it was a very it was like a block. You just put autism and that's it. But now they have so many different spectrums, and in fact, I would like to say that even awareness has gone even up to Hollywood and even Bollywood, Collywood. They're making movies now about autism, and that is increasing awareness, and that gives a good rise for people, for big data, especially I would say people of administrative levels to say that, hey, you know what, we're actually dealing with this disease. Because when unfortunately administrators, when they look at something, they look only at numbers. So if Dr. Shan manages to, if you look at Dr. Shan's data and you say that, hey, he is detecting a lot of patients with autism, does that mean there's no autism outside? No, there may be, but the problem is we don't have enough people like Dr. Shan to actually detect autism. So at the end of the day, this gives rise to a few different things. And I also like the fact where he mentioned about caregivers and gadgets. Like I think Vance, a couple of weeks ago, we actually mentioned that children below 2 are not supposed to have any gadgets. They're not supposed to look at kids programs. I think in France they've cancelled all kids programs for less than 2 because, as Dr. Shah exactly put it, from the research done, they actually feel that the child can. Those days, our parents talk to us, and then they get a feedback. We get a feedback, and that is how communication happens. These days, you just have to use your finger and press, and that's it. You get the feedback. So there's no need. I don't know. From a child psychological journal, they actually say that there's no feedback mechanism. When there's no feedback mechanism, and it's only one way, and that prompts perhaps things like speech delay and all that. So I think that is also another thing which we're looking at. But again, how do we know all of this is because of awareness? And Dr. Chan actually hit the nail right on the head. Is awareness, awareness, awareness. And I think medical science and all can only evolve once there's enough awareness.
Thank you, Dr. Arvinda and Dr. Shan. We have some questions that came up, so I'm going to read them up. I mean, some just to support as what we have discussed. We have Junita here. She said, my daughter-in-law is teaching special kids in school. She tells me it's not easy handling them as they change their anger to calmness within instantly. And I think that is the child givers, I think they always, or even the educators, are going through, I think they are trained at some point, but also it's not an easy task that they are going through. We also have Deepam as well. She said, very true, Dr. Shan, growing concern. So she agreed with your comments and what you have talked about, Doctor. But Doctor, we also have a question that we came in, but before I take the question, that we have that the viewer has asked here, I'm going to flesh it out in a while. But before we go there, maybe can we just talk very briefly, or rather very as short as possible? Does autism worsen with age? After this, then we will go for the viewers' question. Dr. Shan, please.
This question again, where to answer this question, firstly, we need to know the starting point of the child with autism. Number one, was the child diagnosed to have mild autism, uh, level 1, level 2, level 3? That's what I mean. When was the child diagnosed? What was the level? And more important than that is what is the continuing care the child gets, right? If you know the child is autism, with due respect to parents, there are children I've seen 2.5. I already know through experience, my observation, they have been coming to my clinic on and off, and I tell them, I think the child, the learning, the behavior is different. I try to be very, say it in a nice way, and they say no, 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 and they don't get the necessary attention. And then when I see them at 4, then in a way it is worsened, because that 2.5 to 4 are very valuable golden age. If you start that early intervention there, they will improve. Actually, I look at autism with hope. If you start early and you give them the right support, the early intervention they need, the occupational therapy they need, and when they are calm, you send them to speech therapy, you have a proper education plan for them, they will improve with age. But if you do not give them the right support, the treatment is the teaching method. It's more medicine, it's the teaching method at the right time, then they can worsen with age. Like I told you Xiu Feng's story, 2.5, but he improved because he was given the support. Even 15 years ago, minimal support in Ipoh, he was given that support, and the mother continued at home. And mother's sister was a teacher, taught her how to do all the teaching aids at home, and they continued. You see, and he improved. Let's say Xu Feng's mom didn't take any action and just left him like that. That means then he would have worsened, because between the children learn the skill by 6 years, so the brain has got the capacity to learn plasticity. Is it? They can adjust by 6, right? So if you give that input, then they make the improvement. Let's say if I saw a 6-year-old who cannot totally talk, not toilet trained, then my discussion is different. I'll tell this mom that, maybe we have to work on the living skills for this child, to teach this child how he or she can take care of themselves. So the worsening or the improvement depends on the care they give. And where is our starting point? Starting point and the care. With that only you can give a direct answer to this question.
Yeah,
Thank you, Dr.
I also just add to what Dr. Shan has mentioned. I remember doing one research when I was in Ipoh, and we found that those children who actually were not intervened by the age of 2 to 3 years old, their outcome and prognosis for autism was actually much less than were not as good as those children who came in at between 2 to 3. And the outcomes of those children 2 to 3, I'm not saying that all outcomes are bad, but at the end of the day, I think those who they fared much better, those who came in between the age of 2 and 3, compared to those I think after 4 and 5. So I think that leads back to the question again, which I think medical science will have to move until we have enough data. We will actually move towards diagnosing early. Those days we had to go to a doctor to diagnose certain conditions. Nowadays, you get patients who come in who know about the diagnosis already because they may have got some tests, some other, they may mental health, they may have got some survey done online, and they come and tell you, doc, I'm having depression, that sort of thing. And then you work it up from there, and then you see whether they're actually having depression or not. And I think it will come to a point where we will have enough validated scales where a parent can actually look up for certain signs, and then they will say, okay, you know what, this is not right. I need to go and get help. And that is going to, I think, make a lot of good people like Dr. Chan, who's doing a fantastic job with children with special needs. I think you're going to see that there are going to be many patients who come in at early stages, and you're going to have so much improved outcomes that other parents are going to be encouraged to bring their children in early. That I think we will move into that direction in the future.
Yeah. And Vince, can I add something to that? And
Please,
the
Doctor.
success is yes, early diagnosis and working as a team, the teachers, the parents, and the therapist.
Yeah.
That's most important. See, the therapists and the teachers do the work alone is not enough. They need to communicate what they are doing to the parents so the parents continue it at home. And I see the best result comes when these three work together. They work together and you get the best outcome.
Thank you, Doctor. Thank you, Dr. Aminda. We have another two more questions, and then after that, we can summarize the whole talk for today, which is what parents should know about their child with special needs. So we have a question that is already been planned for Dr. Shan, which is, of course, the topic is now, two topics that we are talking right now. I mean, of course, special needs, but this dyslexia also we are coming in there, which is not autism. But what is your take on this particular question that we are talking about here, Doctor? Dyslexia is a learning difficulty. In your experience, how do adults cope with their learning difficulty when they hold a job, especially when they see the numbers, or when they start to read something, things get jumbled up. It's a different view. I can easily say, Dr. Arminda, hold the cup on the handle, but I'm actually holding onto the handle and you are not able to see. Unless if I turn around, then possibility, there's a two views that one person can see. What is your take on this, Doctor? What will your advice be?
Okay. So- Okay, I'll start this by saying first 10% of school age children have got dyslexia. And this is a known thing. All governments know this. But why? Then you'll ask me, why aren't they screening? Because if you screen, then you must provide support. You must have the support. There's no point knowing a person got dyslexia, but you cannot support. Number two, what I'll say is His Excellency, the previous Prime Minister of the late Mr. Lee Kuan Yew himself has got dyslexia, and see how successful he has been.
Thank you, Doctor.
So, yes, dyslexia does not mean you cannot perform. You see, in our age, we learn to adjust accordingly. We have this reading difficulty. Everyone thinks dyslexia is reversal of number, and that, yeah, that's one part of it. But it's a learning specifically to reading, writing, and spelling, and then you get into difficulty as a result of that. However, many of us have learned to cope with it. Many doctors, engineers are dyslexics. They're dyslexics. Yeah, there might be spelling mistakes, but they have learned to cope with it. It's The problem arises in the older age group is when they know they are trying. No, dyslexias, they try very hard to do it right. However, they can't get it right. And then the frustration sets in, and how they handle that frustration. If they cannot handle that frustration, then you will see children like this young person that I saw with anger. Then anger becomes an issue, and then that causes the deterioration in the functioning, not the dyslexia itself. As this 14-year-old boy, he's managing all right in school. He's having great difficulty with maths. However, in other language-based subject, he has learned to cope. He's learned to cope, though he's got good days and bad days. So they give him some one-to-one class to manage. However, what I feel his stumbling block will be his anger management. When he cannot do it, he gets frustrated, he just blows out. So this is what may be a problem in holding a job as well. So that is why identifying it and supporting it will be helpful.
But
I
really,
hope I've
Doctor,
answered it.
of course you did, Doctor. But what I'm actually like to state at this point of time is employers who does job interviews or even managers. If a person who has a special need, even for dyslexia, I think they should be a bit flexible. If, of course, if their work environment or that particular work is able to handle it, then I think they should hire. All right, they shouldn't be have certain judgment. Of course, if the job requires a certain sensitive, which requires that particular aspect of job, then of course they can look up for. But why am I saying that is because I like to share this quick story, which really happened. This happened about 4 years, 5 years back when I'm back in my corporate life, where I hired a particular person with dyslexia. After the interview, he bring me aside and told me, he said, "Boss, I have this situation." I said, "Perfectly fine." I said, "What is the situation that you're going through?" He said, "He can't SMS, he get confused, he can't write down. But as you want to be in the personal training or the fitness aspect, you need to constantly write, you need to constantly message to your clients and so on and so forth." I said, "It's okay, we can improvise." So we did some special privilege for him. We did improvise, but we didn't lower the expectation. We want him to do it the thing. And the best beautiful thing about it is his spouse. I still remember the spouse is actually the one who writes the program for him. He explains to her, she writes a program, and then when he go back home and he explains what are the messages to be typed to certain of his clients, the wife does that. So I think having a spouse is like a blessing. It's like an angel beside you for these kind of situations, even for the family support. I think it's very important. Do you agree on that, doctors? What do you think? I mean, of course, situation is situation, diagnosis is diagnosis, but if the other half is not there for you or the family support is not there, the immediate, I think that person can lead to even tremendous situation, not in a positive side. I foresee a lot of negative sides coming up.
Yes. For all those with these additional needs, the support is very important. It could be a spouse, it could be a parent, it could be a sibling, it could be a friend. Someone who keeps uh, keep them motivated. Yes, the support is very, very important. For children, when they go to school and they're having dyslexia in international schools, we support them with letters to say they need extra time. Sometimes they need a scribe, or allow them to use a laptop to answer. They may not be able to write very fast, so they're given the accommodations. So support can come from a spouse, can come from a parent, a friend, or an institution as well. I think for your institution to employ this person and give him that space and time itself is a support. So it's that understanding and that empathy that is very, very important in bringing out the best in individuals with special needs and in all individuals actually.
Because, doctor, the moment when we do certain changes, and of course, not lowering the expectation, but keeping the standards high, I think he was very appreciative. He was shocked that he was hired for this particular job, and he performed his utmost best, and he gave out every single thing. So I think disability doesn't happen to the body, but it happens to the mind. One who lazy, refuse to get up and work, or even for the matter of learning abilities, I think it's all the matters of the mind. Don't you all agree with me, doctors? To a certain point. I mean, of course, certain cases we can't classify that, but do you all think that mindset is also very important in
Yeah.
these particular
Arvinda,
cases?
you like to take first? Yeah, Arvinda.
Ramida?
Okay, I talk based on facts and figures on research papers. We found that a lot of parents who had support from their parents with dealing with children with disabilities, or any caregivers who were giving caregiving for a person with any ailment, or in fact any disability, you find that the more people are there to support, the better the child's outcome, and the less you will find that there will be a burden of caregivers in terms of emotional burden, for that matter. I think also the other thing is we constantly think of is that uh, I think we have to look at which is the area or niche area of this particular. If you look at certain movies which they talk about spectrum disorders, that particular child may not be good in certain things, but they are very good in certain things. So it is the case of you can't scold a fish for not being able to climb a tree. You know what I mean? So basically, I think it is important that, and how Dr. Shan has put it, it is a team effort between multiple people to actually find out what the child is actually good at and where the child needs to sharpen the skills. Because at the end of the day, if you know what the child is actually good at, you can actually help the child to move forward. And I'm speaking basically on research. You help the child move forward based on their good skills, and you also improve whatever skills that you feel that you're deficient in. So at the end of the day, you find, I think, it becomes it becomes a wholesome thing, especially if you're trying to prompt and prepare the child for the future. And I also see somebody has asked there autism and Asperger's, and I think you're getting the hint of which movie I was actually referring to. In that movie, that person has Asperger's syndrome, but that person is very good mathematically. He can see, or she can see designs of engineering designs in their head, but they can't put it on paper, but they can see it in their head. And it is the ability and the skill of other people to actually sharpen so that they can actually put it on paper, so that everybody benefits from it. Doesn't mean that the child is, a lot of people say, oh, the child is, they treat the child as if the child is having a debilitating disease. They wrap the child in bubble foam, but they don't allow the child to actually express themselves. I mean, Dr. Shan can correct me if I'm wrong. And when they do that, they actually find, hey, that the kid is actually very, very good in certain things. But of course, you want a wholesome thing, you want them to develop. But at least you know where to focus on, where to progress in the future. I have seen one child who has ADHD. Uh, may or may not be related, but the child is very, very good in mathematics. Even though ADHD, they can't finish, but when they sit and they do, they're very good in that. I had one more, not to mention names, but a very, very famous singer in part of a very big band in the US actually has openly talked about ADHD. Adam Levine, he has talked about ADHD. He has ADHD, but he's a fantastic singer. So does that mean that these children are disabled in many ways? No, I think they're sharp in many things. They may be deficient in a few things, and it is our duty to actually make sure that they develop wholesomely. And the rate of them being educated or developed may be a bit different, and that is why I think at the end of the day, these children need special attention, so that especially in schools, so that they are given a fair chance to actually sharpen their skills and even mindset. That's my take on it based on the research I've read and done, and of course some patients which I've seen.
Dr. Shan?
Yes. Okay. Wow. Overwhelmed with your answer, Arvinda. No. When we assess the child, we always look, I think what Arvinda was summarizing, strength and weakness, and we focus on the strength of the child. So they have individual strengths, and then we work on their areas of weakness to enhance their strength. And can you remind me back the question again?
Oh, okay, doctor. So we talked
Yeah,
about there you go.
do you want me to answer that question on the screen? What's the difference between autism?
You can answer
See,
both.
okay, the mindset. Yeah, I get it. The mindset. Yeah. See, when I started speaking as well, I said first thing is I work with hope. And hope, where does it come from? It comes from your mind. You have to take a positive approach. But a parent, when they have a child with autism, will go through a emotional turbulent period first. This is a natural process, not just with a diagnosis of autism, of any situation that is dashing to us, which is difficult to us. We go through a phase to adjust to it. So the first step is for them to come to acceptance. After going through all the difficulties, acceptance within themselves. The moment they have come to that acceptance, then their mind is focused, mindset is set, and now they focus on how I'm going to take my child. Not worried about what others are going to say about the child. So I agree totally. The mindset is very important. And for us to approach an individual with autism, we also should look at it in a we should be accepting differences. We should have a mindset to accept differences and always look at their strength, not just their weakness. Yeah.
Thank you, doctor. Thank you so much for the past 1 hours in discussing about topics that's related to dyslexia and also autism with special needs kids. I think we covered both the special needs and the parents as well. But just a last segment, I think maybe we have another about 2 more minutes before we end the show. What will your advices be, doctors, for parents who have a special needs, because we have to understand them as well. They are on a 24-hour duty for that particular child. It's out of love. It's never out of burden or out of something they have to do. But I think it's their own. But as we talk about this, we also have to give it to them the utmost respect, because mentally and physically they can be exhausted, but they never probably taken that as a job. Dr. Shan, what will your advice be for a parent who has a special need, and what your advice will be to that person who's going through these challenges? What's your wise and wisdom words, sir?
Is my would be take one day at a time. Look at the child and not the autism, and take one day at a time. These behavioral issues will be in children without autism as well, right? When we are so focused autism, that's when it creates more stress in us. And when we are focused about what others are going to tell about our child, that creates stress in us. So take the child as he or she is. I know it's easier said sitting here than doing it, but if you focus on it and you take your child as he or she is and take one day at a time, work along with the teachers and the therapists, good result will come out. Yeah, that would be my.
Thank
And
you.
can I also just quickly answer that autism and Asperger's?
Yes, doctor, please go
As,
ahead.
yes. Yeah, the Asperger's under previous classification they had Asperger's and autism. Asperger's is usually are children who have features of autism who do not have the speech delay but have all the other features of autism. They're supposed to be high functioning autism. Right now, under DSM-5 classification, they only have what is called autism spectrum
Spectrum
disorder.
disorder.
Disorder, and then you classify them as level 1, level 2, level 3. That's it.
Thank you,
Vinda?
doctor. Thank you, Dr. Shan. Dr. Arvinda, your part. I mean, of course, Dr. Shan has also mentioned, as we talk very professionally in terms of medical science, we talk about the possibilities and the solutions in the current situation. But we also understand, is like what Dr. Shan has clearly stated on the spot, that it's easier said than to be done. But Dr. Shan's advice is take one at a time. But as a parent, the mind, it can be either be a devil or you can be an angel. It always can work for us, or it can always work against us. Despite with the current challenges with COVID-19 and so on and so forth, with unpredictable economy, which is of course now things are probably in the greener side, getting better. Parents who are having a special kids, what is your advice, doctor? Again, what do you think they can do to manage their stress, manage the situation? Of course, not one shirt fits everyone, but what will your advice be?
I always feel there's two sides of the coin. This side of the coin is the parents sometimes they get too engrossed into looking after their children that they forget to look after themselves mentally, physically. I know of some parents who have children with special needs who forget about their own health. They forget to go for their health screening. They don't look much for their health screening, and they get ill. I always tell these parents that they have to look after their health as well because, like how Dr. Shan already, mentioned just now, what if I'm not there at the end of the day? So I always tell the parent that you must be there for your child as much as you can. Now, you don't want to have a debilitating disease. You don't want to have a child with a stroke parent because if there are two parents looking after the kid, there will be one parent who has now two people to look after. So I said that is also one more thing we have to look at. It is nothing that we are not discriminating anybody with any debilitating diseases, but I think we have to remember that in general we have to look after our health, and that is the one that is going to help us to look after that particular child or anyone with as a caregiver. Let's put it as a caregiver. So I think that is most important. And the second thing I would do is to listen to Dr. Shan because I think he gives very brilliant advice there. I think at the end of the day is we cannot focus. You see, I always remember somebody told me once that if you take a white sheet of paper and you draw a black dot, everybody looks at the black dot. Nobody looks at that white paper around the black dot. So I think let's not talk about children with special needs. I think generally, why don't we focus on these white areas? Why do we look at the black dot just because it's very glaring? We all have to appreciate that there's white space in our lives. I think we have to look at, okay, this child, maybe the child has been gifted to particular sets of families because God feels that these families are strong enough to actually bring up these children. And as how Dr. Khan mentioned that his patient and he's doing accountancy, I think that's a brilliant story. It is a story you can tell over and over again and not get tired of it because it's so inspirational to many people. Despite of it may be a sentence to some, but it definitely is it's an entire book to many. And I think at the end of the day, we have to look at the entire needs, not only for the child, but also the family. And Dr. Shan has put it absolutely spot on. I think along with looking after the child, there must be some support for the family as well. Not only for the caregivers, for the siblings as well. Sometimes the sibling, there may be one sibling who wants to play with another sibling, but they don't have that avenue to that. So that child may also need to be talked to, to mention that you have to play with your sibling. That interaction may also help. So my final parting view is I think we need team support, not only one person. It should be at least three, four, five, six, seven, eight, nine people for that matter. Of course, too many people spoil the soup, but I don't think in this case. I think everybody has their own role to play. Everybody who discusses keep forgetting that there may be another child at home. That child, because all the focus and attention is going on that one particular child, that child may be feeling left out. So that also is another story by itself. So I think it is a team effort. If you include everyone in it, I think everybody gets uh, some responsibility out of it, and I think it only benefits the person who is getting the caregiving at that matter.
Thank you so much, Dr. Arvinda. And Dr. Chan, do you have anything to say, Doctor?
Uh, to the parents, if you feel overwhelmed, right, uh, you must always reach out and talk to someone. It could
Agree.
be for the mother, could be her mother, or it could be a friend that you can communicate well with. It's not always need to be a professional.
Yeah.
If you feel overwhelmed, it is. That's why the support groups, and Speak to someone you trust. Bring it, don't hold it into you. Number two, as Arvinda said, parents tend to forget that they are individual. They just sink into it. You must take care of your health as advised by Dr. Arvinda. That's very important. Physical health as well as mental health.
mental health. Yeah.
And also, do not forget the siblings, as he said, because they're going to cause sibling rivalry, going to make it worse. Yes. So, a holistic picture.
if
Thank you, Doctor. Thank you.
if some people sorry, some people don't want to get help from people who they know, so they can actually contact a lot of people like befrienders, a lot of other social groups outside who actually welcome people to just someone who's just to talk over the phone. Sometimes they just need to vent out certain things, and I think that helps as well. So I think that's also another avenue.
I just got to say thanks to the both doctors today for bringing up such a great topic. We talked about the current condition and also the mental state of the parent, and some tips and advices what a parent should do who have a special need kids who are actually going through a 24-hour duty. I call it because they don't have even a single second of rest. It can be a very tremendous, like what the doctor said. What we are saying that they should look after themselves as well so that they can look after their loved ones. So, having said that, thank you, doctors, for joining us for almost 1 hour, 30 minutes in this Wednesday talk with Kopi with Vans. Dr. Shan, thank you so much. We know what happened, and despite that, you didn't cancel, even though we wanted to postpone and we want to carry on, but you want to be in the show. So, I really, my greatest appreciation for you, sir, for joining us. And
Thank you so much.
thank
The
you.
spreading the information of the special child, creating the awareness and positiveness is very important. Thank you for the efforts, Copy with Vans, and thank you, Dr. Arvinda, for introducing me to Vans. Thank you.
Thank
Most
you.
welcome.
Thank you, Dr. Sean. Thank you so much. Thank you, Dr. Arvinda, as well. As usual, we will recap all the stuff that we talked about. So we have about another 2.5 more minutes before we can shut off and call it off a session. So as we talked about, Dr. Arvinda, I think we must give the greatest appreciation to the parents who has a special needs kids as well, because like we mentioned, they might be going through a lot of things might going through their mind, and they might look happy but they might not, right? Only their worries, they will know it. And you mentioned it well. Dr. Shan has mentioned it well, and how we can actually overcome this problem as together as a society. I think I would like to keep on stressing on the society as well, because society plays an important part as well. Even though sometimes we can just ignore it, but unfortunately, if a parent is going through a major challenges such as this situation, sometimes the words, all we can say is some nice words to them. So at least they feel comfortable, helping them out in any form of ways as well. And I think that is a true human being. Don't you agree that?
I agree. I think the society plays a very big role because positivity among the family may be at very, very high levels. All it needs to do is take someone from outside to just disrupt that positivity, and it can bring not the one person down, it can bring the entire family down. I think it is society needs to step up these days and acknowledge that that things like that happen. And I think that again goes to awareness, and that is how we actually know, and we can actually awareness does not mean that a person just ignores or this. They can also be supportive. You may want to say that, oh, okay, your neighbor has a child with special needs. You may want to see, you see the parents exhausted, go and tell the parents, hey, you know what, why don't you all go and have a night out, just go and have some time out. We will look after your kids for a short period of time. That small basic thing, that 2 hours may not mean much to you, but it will mean the world to the parents. I think society can step up in many different ways. Society can actually observe, and when they observe, they can tactfully tell the parents, if the parent is ignorant or the parent doesn't know that there's something wrong with the child, somebody who is elder or somebody who knows and sees that can actually go and tell that, uh, your child is giving as such, do you want to go and meet someone, or do you want to see someone, or you can send them materials to read about to increase awareness and get them the early treatment which is needed. So I think there's many things society can do, but not be a wet blanket. I think being a wet blanket doesn't help anyone.
Thank you, Dr. Arinda, as usual. Our guest speaker on Kopi With Vans, anything to do with health topics, you're always there giving your experiences. And as a as a qualified doctor, you're still studying as well, doing your PhD. And I think a doctor's journey never ends the moment he graduated in MBBS. That's where I think his journey of studying and upgrading carry on for another 10, 20 good years. So by the time you retire, you're still studying. And for education in a doctor's life is never an end. It's always a comma, or if not a question mark. It's never a full stop, right?
Or a dash.
Okay, you too have a good rest, and thank you for joining again. We will catch up again for another exciting episode at Kopi With Vans.
Great. Thank you, Vance. Thank you, everyone. Take care.
Thank you so much. Thank you so much. All right, viewers, thank you so much for joining today's topic, which is almost about 1 hour 30 minutes. It's almost 11:30. Thanks to all the viewers who are still tuning in right now. And today's topic is all about child with special needs with Dr. Shan Narayanan, who is we call it he's an expert, and the way he explained was just tremendous, right? He gave all that pointers. We call him the special child. Take it one at a time, and also focus on what is current situation, and give your best facilities, or even for situations or anything that you can provide to your child for special needs. That's Dr. Shan Narayanan and Dr. Arinda as well. All right, I'll catch you again on your next topic, on an exciting topic that's coming up next Wednesday at 10 p.m., which is already set up. And I'll catch you then. Till now, bye-bye. Till then, bye-bye. See ya.